So when I talk about hidden causes to weight loss resistance that kind of go unchecked, like things that typical situations don't look for. Labs don't necessarily look for these things. Certain doctors won't look for them either because they're looking for diagnoses when they run labs. They're looking for markers to be out of range to give you a diagnosis. So when I say that there's things like mineral depletions or toxin burdens, or even like stealth gut infections, like bacterial imbalances, this is what I'm talking about. So this is just a typical CBC with differential that your doctor typically runs for you probably once a year if you go in and ask. It also includes platelets. We have some white blood cell and red blood cell markers here. When we start down here at neutrophils, this is a breakdown of individual types of white blood cell white blood cells, and they have different jobs, very specific jobs that they do. And so when I'm looking at them, as you can see, none of them are flagged. That means they're all diagnostically normal. That diagnostic range is over here, and it's pretty broad. But when I'm looking at these markers, I'm looking at a very tight, narrow, like optimal range, and where they function the way they're supposed to. And in that, looking at these markers from a functional perspective, the neutrophils are on the low end and the lymphocytes are on the high end. And that right there, just that, these two markers that are in this like seesaw pattern, these are ranked in order of size. Like, so neutrophils should be the biggest one because these are in a seesaw pattern. I already know out the gate that there's some type of bacterial imbalance. When I go a little bit further down, I see that the monocytes and the eosinophils are also functionally high. Now, monocytes act like a janitor. They clean up a mess after a big party. So let's say there's been an infection and there's just a whole lot going on. The monocytes will come out in force to kind of fight against that. So this number is actually elevated. But right here, the eosinophils, they elevate in response to things like inflammation, asthma, allergies, and parasites. So knowing that these two are kind of in a seesaw pattern, indicating there's something bacterial going on, and that these two are elevated, one of the indications might be bacterial parasites. This does not mean that this client actually has parasites. What this means is there are some patterns that reflect the possibility of parasites. They are indicating parasites, but this is in no way a diagnosis of that. And before I even cross that bridge, I look at every single marker on this lab, and there's like 85. And I'm looking at how not only they are operating individually in terms of that functional range, but how they work kind of in concert together. And so that's where we see patterns emerge. And in this case, there is a parasite pattern present, but that doesn't necessarily mean that we need to kind of come in with guns blazing and go after parasites. Not at all. In fact, because of this, I would recommend some further gut work to kind of determine what else is going on in the gut and see if we can actually uncover something like a parasite in the gut. But the point is that these types of approaches are not utilized typically. And so you'll be living your life thinking your labs are normal when actually there's something getting in the way of your weight loss. These are not situations that you can just out diet or out exercise. You can't just eat more protein and get rid of, some type of pathogen burden or reduce your toxin load. Like, it takes more than that. You actually have to come in and look for them specifically. And then you need to address them with precision. It takes a delicate hand, and you have to really know what you're doing. And so this is the work that I do with my clients every single day, but we do it gently, we do it strategically, and we do it effectively. So if you're someone that is ready to just kind of stop the guesswork, the things that you're doing should be working, but they're not. Maybe you're not losing weight, or worse, maybe you're gaining weight, doing things that should be helpful for you, okay? But you're not seeing the progress that you want. Most likely it's because there's something hidden underneath that you're just not aware of. Something like a mineral depletion, a toxin burden, or some kind of stealth gut infection that, is wrecking your immune system and your digestion. It can be just as simple as that. So if you're ready to figure this out, just message me root cause, and I will reach out to you to help you kind of start to finally figure out what's going on and why your body's stuck, but more importantly, what you can do about it.